welcome back to my channel. This is Jazz Life, and today I'm going to be talking about my experience working as a home health nurse. So after I worked about 6 months on the med-surg unit, I explained in my previous video about when I was an orthopedic RN. I'm going to put the link in the video if you haven't seen that one. But after that experience, I just knew that I didn't want to do bedside nursing anymore, and I needed to find my niche in nursing. So I thought about, exploring more of community healthcare, school nursing, and eventually home health. And while I didn't really have any experience as a home health nurse, I did have some experience when I did nurse case management, which was basically like the same thing, like going into patients' homes, but instead of providing typical nursing care such as like wound care, like giving medications, it was more of like a consultation with the patient and their family to see what they needed and to kind of be the liaison between them and the healthcare team. And when I did case management, the thing I liked about it was that I was able to like have a flexible schedule. I would call my patients up and like book them for the time that I was available. So in a day, I could have 5 patients, like see one at 8, 9, 10, and then in between that, I could like do some documentation and just like get organized. What I didn't like about working as a nurse case manager was the fact that I had to drive a lot, and sometimes it would be driving to the patient home after making the appointment and then finding out that they are not available. Also, scheduling was very difficult because sometimes you would call people and they wouldn't even know their availability, so like you kind of had to be flexible and make it happen. So when I applied to work as a home health nurse, I wasn't really sure if it was going to be, managing the care of multiple patients or being with one family. But at the time, because I had a lot going on, I just knew that I wanted to do more part-time and kind of like get my foot in the water and see if I like it. So after my initial interview, I went in to the agency and they did kind of like a clinical assessment to see what skills I was able to do and to kind of coach me on other skills or machines that I wasn't comfortable with. The process was actually very quick. And then after the skills, I had the opportunity to look over a couple patients' charts and really decide if I wanted to work with a pediatric patient, stick to an adult patient, and also what was most important to me was the distance, because I wanted to be able to be available. And like, with a car issue, like you never know what's going to happen. Also to add on to the fact that like I don't like driving that much. So I decided on a 4-year-old patient who had multiple past medical history, a history of congenital heart defect, respiratory issues, feeding problems. He had to be fed through a G&J tube. He wasn't really able to swallow, so he had not only swallow but speech difficulties. It was just a lot of it going on. He was a quadriplegic. And initially, when I looked at the patient's chart, it felt like very overwhelming because, first of all, I hadn't been able to like properly manage care for a pediatric patient since I was an adult nurse. However, I was confident that the skills that I had learned whilst working as an adult nurse would be able to transfer over as a pediatric nurse with slight changes and, the way of approaching the patient and just like my nursing style in general. I interviewed with a family, and when I interviewed with a family, I wasn't really sure if they would take me on because it was just kind of like a joint interview where I'm seeing if I'm compatible with them just as they are seeing if they are compatible with me, which I like that aspect of having to be able to like meet the people and have like that like first impression and choose. So after meeting with them, we decided that I'd be working like a 24-hour week, Monday, Tuesday, Wednesday, between 11:30 a.m. to 7:30 p.m., which to me, like, it was a nice schedule. And I was able to train my first shift with another nurse who had been working with him for a couple years. And that was helpful because he just had, like, a lot of different machines that I wasn't used to, or like were different from what I knew. Even like, say, like the nebulizer was different. Yeah. Working as a home health nurse comes with many difficulties, but working as a pediatric nurse also has its difficulties, in the sense that you're not taking care of just the patient directly, but you're also interacting with the family and they with you to make sure that everything is on par, because again, it's their child. And especially if the child is unable to manage care on their own, or to be able to communicate with you about their needs, it's basically like you're looking up to the patients, up to the family, to give you clues on the child's routine, what their facial expressions mean, and how you can basically be the best nurse for them. Because again, everyone is an individual and everyone has a different level of need. So my experience with home health nurse was basically just one patient. Although I could have added another patient to my schedule, I decided not to, because it was my first time providing that level of care. And I just wanted to make sure that I got comfortable first before adding more people to my arena. I wasn't familiar with the documentation style because it wasn't Epic or an electronic medical record system. It was more handwritten charts, and like overviewing like the medication list. Everything was like paper and hard copy. So in a typical day, I would come in at 11:25 or earlier to meet the kid when he came back from school by 11:30. I'd get him from the school nurse, because he also had the school nurse that would go to school with him and bring him back. I'd get like a slight report from her. How was he feeding? How was his respiratory issues? Was he junky? And then I'd bring the patient in. If he was sleeping, I'd put him to bed. If he wasn't, I'd still put him to like rest on a mat and make sure that I gave him his afternoon medications. And then we just kind of like play along the day, like listen to like Cocomelon, make sure that he was stable, wasn't having any respiratory issues, that he was peeing and pooping, and that nothing was off. His vitals were stable. And it was typically an easy schedule and a more predictable schedule, in the sense that like each day that you came in, you kind of knew what to expect, with occasional changes here and there. And besides me coming in as his home health nurse, he would have, say, physical therapy or speech therapy or music and life therapists that would come in. Oh, is it special life therapy that would come in and play with him, interact with him, work on his skill set. And it was interesting to be able to work with all these healthcare professionals. And it really provided a lot of insight to working with a patient as a whole. And I know that in the hospital, yes, like we are working with an interdisciplinary team, but you're managing the care of 6, 5, 4 patients, and that's different from being with one person and truly being able to observe and be present and see the changes that is happening and see them improve and so forth. And as a home health nurse, with the little experience that I had, I quickly found out that like you had to be flexible, in the sense that sometimes the family would need you to come in earlier or a little bit later. And even though it was up to you to be able to say like, yes, I can, or yes, I couldn't, at the end of the day, you are here for a reason, to help these families, and you're here to be with them and their children or their partners or whoever the patient was. And you needed to be able to be flexible in order to be able to do so. Another thing was like going to doctor's appointments with patients such as these who they always need like one-on-one care in order to make sure that they are safe. You can't really like leave them by themselves. So to doctor's appointments with the parents, I had to be present so that if the parent is driving, I could be in the back seat with a child, making sure that they're stable, making sure that any meds were given on time, and that they were just like comfortable for the ride. And so working one-on-one with these families, you really get to know them as a person and they get to know you. And you really start to build a certain type of relationship and rapport that I couldn't experience when I worked as a med-surg nurse, because like there's such a quick turnover of patients that just when you're getting to know someone, they're leaving. And the patients that are there for an extensive period of time, it's because they can't find long-term care facilities or rehabs to place them into. And especially with COVID at the time, we didn't really have a lot of family members coming in. There were just like major restrictions on that. What I didn't like about my experience during the home health nurse was the fact that, or just like maybe it's just pediatric patients in general, you have to deal with the emotional lability of their parents, because again, having a sick child is something that is stressful, is something that is sometimes overwhelming for the parents. And even when they do possess the knowledge and they do possess the skill set in order to understand their children's condition, you worry about whether they trust you as a person, whether they trust you as a nurse to take care of them. And you also have to consider that sometimes it's not always personal. You know, these people may have had experiences in the past with nurses who haven't provided the most optimal care, or even nurse practitioners or doctors who have kind of given them like a bad impression about healthcare professionals in general. And you struggle with making them trust you and care about you. And it's a working relationship that is not always easy. So if you like the autonomy, if you like the reduced patient ratios, if you like to have kind of like a controlled schedule about your day, or at least have an idea going in on, okay, this is the routine that you're going to do, then I think home health nursing, in my opinion, is great. And especially like if you don't have a problem interacting with the patient's family or even extended family members, their parents, uncles, aunties, grandparents, like whoever may be present in the patient's life, then I think that you should really explore home health nursing. And I also think that home health nursing is great for when you're in between positions, or you're trying to really find something that's going to suit you long term. You could kind of dabble part-time and see how you feel, or you could also do it full-time if you realize that that's really like your niche and that's really your practice. Me personally, right now, I'm in the middle of a lot of things moving on. I got engaged. I'm moving away, and I'm gonna make a video about changing your licensure from one state to another, because I just felt like there wasn't a lot of content to be placed out. There wasn't a lot of content when I was trying to get, a different licensure. So my fiance got accepted to medical school, and as a result, I've decided that I'm gonna move with him to the state of Tennessee, and currently residing in Massachusetts and graduating in Massachusetts. So I only know how I got that license. So getting my Tennessee license was a whole process, and it cost a lot of money, in my opinion. But I think it's worth it to be able to have different licensures. But in the next video, I'll talk about the whole process of, being able to work in different states. But anyways, this was just a quick video update on the kind of nursing I'm doing now and what I have coming up in my future, which I'm going to be recording like also more lifestyle videos. I'm currently in Ghana at the Movenpick Hotel. I actually came here I actually came here for my future sister-in-law's wedding, and I'm just gonna give you guys a quick view. Might as well, right? Might as well. So that's the view. Accra, Ghana. I think it's the Ambassador branch. They have like other branches, but yeah. So anyways, thank you for watching my video. I'm going to be having more updates soon, but like, subscribe, and let me know if you have any questions about my experience doing home health nursing, and I'll see you later. Bye.